Hello, my name is Dr. Jennifer Daniels, and I'm the author of Do You Have the Guts to Be Beautiful, as well as a formerly board-certified family practice physician. And I'm here to talk to you today about the 5 essentials to selecting the safest doctor for you. Many of you are probably aware of the crisis in United States healthcare, the crisis being that 767,000 people every year die at the hands of the healthcare system. And so it's really, really important, since everything that happens in the healthcare system generally flows from a doctor's order or a protocol the doctor is following. And so it's important to pick the safest doctor possible if you're going to pick a doctor at all. So let's go over the 5 essentials to picking a safe doctor. First thing is, it's very, very important that the doctor not be board certified. Why is this? Board certification means the doctor has completed training and has passed an exam with several questions, and he has answered them to a certain level of proficiency. Usually this would be a good thing. However, the board certification exam questions, as well as the training programs, are structured and designed by the drug companies that make pharmaceutical drugs and habitually write lethal, that would be deadly, protocols. So the 767,000 people who die every year in the United States is not an accident, but a result of deadly protocols meticulously followed. So the first thing is, do not see a board certified doctor. Next thing is, if you do see a board certified doctor, make sure that he's at almost the end of his board certification period. This way, his following these deadly protocols will be tempered by input from patients and other feedback. For example, if a doctor takes his board certification recertification exams every 10 years, then you want to ask him how many more years he has to go before his next exam. So if he's like 2 or 3 years away from his next exam, then he's not nearly as deadly as he would have been, say, right after he passed or completed his exam. So number 1 is not board certified. Number 2 is that the doctor should not be in a group practice. If a doctor is in a group practice, this means he has a tremendous amount of peer pressure from other members of his group to stick to these deadly protocols. But the second influence is, when a doctor is in a group practice, he's under a lot of pressure to carry his weight, to increase his billings, to bill enough to justify his share of the profits. And so in a group practice, you're much likely to have a doctor adhering to deadly protocols and recommending therapy that is either not effective for you or even dangerous. So you want to pick a doctor, if at all possible, that's not in a group practice. Number 3, you want to pick a doctor who takes his own night call. This is really critical. If a doctor is prescribing drugs that are dangerous, patients do not usually drop dead immediately. Usually they call with a complaint that the drug's not doing well, or that there's a problem. There's an early warning, a danger flag. And if a doctor is not taking his own night call, then when he prescribes a drug at 10 a.m. in the morning, the doctor who answers that call at 10 p.m. at night is not going to be aware a new drug was started. And that first doctor is not going to get the feedback he needs to know, whoops, this is a dangerous drug, I better ease up or stop prescribing so much of it. So you don't want to see a doctor whose night call is either shared with other people or is outsourced to who knows where. This is very important, because you want a doctor who gets his valuable nighttime feedback about his daytime activities. And such a doctor will be a very careful, very cautious, very safe doctor, because nobody likes being waken up at 10 p.m. And I can tell you, when I practice medicine, if a person called me at 10 p.m. or 1 a.m. about a drug I prescribed or started earlier that day, I crossed that drug off my list and did not prescribe it anymore. And this resulted in not using drugs that were actually later recalled. And so it ended up creating actually a very, very safe practice. So a doctor who takes his own call is critically, critically important. That's number 3. Number 4 is, you do not want a doctor who has full hospital privileges. Now, there's all kinds of hospital privileges, but there's something called full hospital privileges. Full hospital privileges means that the doctor is able to admit as many patients as he wants to a hospital, but it also means that to maintain those privileges, he must admit a minimum number of patients to the hospital every year, whether they need it or not. This is very problematical because your chances of dying of a hospital complication, which would be getting the correct drug and the correct dose but just happened to lead to death, or getting the wrong drug, or getting a hospital-acquired infection, or any of many things that might happen to you, is actually very high. So your chances of dying just because you went to the hospital from a hospital complication are 100 times higher than if you were outside the hospital, all-cause mortality death. And that's a real shocker. So just by walking into a hospital, laying down in a hospital bed, even though you might be in perfect health, your chances of dying have increased 95 to 100-fold from what they would have been had you just been walking down the street or even driving in a car. So a doctor with full hospital privileges is also under incredible pressure and actually gets phone calls from hospital administration saying, "You're not admitting enough patients. Why aren't you admitting more patients? Can't you find more patients to admit?" And then in you walk with a disease that could be handled as an outpatient or inpatient, and what's the doctor going to do? You got it. Whereas if a doctor has courtesy privileges, he's under no pressure from the hospital. He doesn't get any phone calls from the hospital, and he's free to handle your situation as a outpatient. Also, he's reluctant to send you to the hospital or refer you because then you go to the care of another doctor, and of course he would lose revenue. So you want a doctor who does not have full hospital privileges. And finally, you want a doctor who accepts payment only from you. This is very, very important. If a doctor accepts payment directly from you, even if you get reimbursed from your insurance company after the fact, then that makes you the boss. You call the shots. And if you're not happy, he doesn't get paid. Whereas if he accepts your insurance, then if you're not happy, he gets paid. If you die, he gets paid. And so you must pay your doctor directly. If you do not pay your doctor directly, then your insurance company will, and he knows that he's going to get paid whether you live or die. So those are 5 quick tips for how to pick a safe doctor. So this is Dr. Jennifer Daniels wishing you health and happiness. Come visit me at drjenniferdaniels.com. Thank you very much.